Okay, we'll get started. Good evening and welcome. I'm so thankful to have all of you here with us this evening. I really am grateful to Dr. Tersak and Heather and Marlena and Noelle for giving us their time this evening to talk on the really unique and special conversation around survivorship. So I know a lot of us may have different questions and can't wait to see where the conversation goes as this group has grown tremendously at Children's Hospital, and look forward to hearing more what each of our guests have to share this evening. Noelle, should I turn it over to you or directly to Dr. Tersak?
Dr. Tersak's going to take it and I'm going to run the slides.
Okay. Welcome, Dr. Tersak.
Thank you so much. So I am very excited to be a part of this presentation tonight. Our group has partnered over the years with VASO and Lending Hearts, and it's such an amazing organization. So it's exciting to be here with you tonight. So the title is Cancer Survivorship, Where Are We Today? And it says, where are we today? And I think in order to put that in perspective, we're going to talk a little bit about the past, the present, and the future. You will meet virtually the people on this slide by hearing them speak, and then you'll hear about a couple other members of the team that you won't meet tonight that are available and wonderful resources within our program. So next slide, Noelle, please. Okay, so this program really is to try to survivorship. We could probably spend 12 hours on. We are trying to provide really essential information about childhood cancer survivorship today. And do want to emphasize that if there's anyone on the call that was diagnosed with the cancer as an adult or has family members that were diagnosed with the cancer as an adult, we're really focusing on childhood cancer survivors. But I think there's valuable information for anyone whose life has been touched by cancer. So you'll hear the term late effects used throughout this program. And late effects are probably a more familiar term would be side effects of treatment for childhood cancer. And that is side effects that can occur from the cancer itself, can occur from the treatment. So that could be surgery, radiation, chemotherapy. And I think the late effects really help to define the importance of a survivorship program, because all of the things that we do, or many of the things that we do, relate to the potential late effects of cancer. We will talk about some strategies for managing cancer survivorship issues, and then want you to be aware that there are many support resources available, many locally, including Lending Hearts, at cancer centers and nationally through things like Leukemia Lymphoma Society or American Cancer Society. And then you'll hear a little bit about research. The cure for childhood cancer has improved dramatically. And the reason that happened was because of really carefully controlled research. And that's what's happening now in survivorship. We have a survivorship population that we're now studying so that we can better understand these late effects of therapy to reduce them and to have a plan to respond to them when they occur. Next slide, please. So truly an honor and a privilege to be a part of and introduce this team. So I'm the medical director. Heather Gaylor, who will be speaking right after me. Heather is our nurse practitioner. Heather and I work hand in hand, side by side, seeing patients and taking care of the medical needs of the survivorship population. So when you have a visit, if you make a phone call, leave a message, one of the two of us will be the ones responding to those things. Noelle, who you will also meet tonight, is project coordinator of something called Survivor Connect. Noelle, I honestly believe, is like the pillar of our survivorship program. She is really how and why we were able to get to where we are today by building a program that helps us to remain connected with survivors between those annual face-to-face visits. And Noelle will talk more about that. Marlena is also on. So Children's Hospital Pittsburgh has a very large research team. We are passionate about curing cancer, and we now have Marlena, who's passionate about research and survivorship to reduce medical late effects and understand the impact on childhood cancer survivors. Donna is a very experienced pediatric oncology nurse, and she's our nurse coordinator. She's the face on the telephone, if you will. She's the first point of contact for our team. And her other critically important role is that she develops an individualized treatment summary for every patient. So the late effects that we talk about, it is so important to know the specific individual plan for that patient. And we'll go through that in a little bit. And then Emily is our social worker. And we're so happy to be able to talk about that because we did not have a survivorship social worker until 1 year ago. You can imagine that the issues that young adult childhood cancer survivors face are different than the 3 or 4-year-old undergoing treatment. So Emily helps us with educational issues, employment issues, insurance issues, financial issues, and really is a wonderful resource and addition to the team. Next slide, please. So survivors are really, in some ways, a new population, and that's because survival has improved for a number of reasons. We have new chemotherapy agents. We've learned new ways to combine and use the old chemotherapy agents, and there have been so many advances in surgery and radiation that more and more patients are surviving. So there's about 15,000 children and adolescents, so if you define that age 0 to 19, that are diagnosed each year in the United States. At this point in time, 85% of them will be cured. So I have 2 comments about that. One is we are so excited that we can say that 85% of patients will be cured. We also recognize that that's not 100%. So although we're talking about survivorship tonight, I want to also just convince you and let you know that we also are just so committed to making that number 100%. So we have an active research program in cancer, and we have an active research program in survivorship. But the other thing is that it means that over 500,000 young adult survivors of childhood cancer exist in the United States right now. So about 1 in 250 individuals aged 20 to 34 years in the United States are a cancer survivor. So for the cancer survivors, that means that if you're at a sporting event or a theater event or in a large lecture hall, there are probably other cancer survivors. Next slide, please. And I think a picture is worth 1,000 words. So this picture shows on the y-axis to the left, proportion surviving. On the horizontal axis on the bottom, year of diagnosis. And the different colors represent different diseases. So although they might be improving at different levels based on disease, I think the take-home message is that they're all going in a positive direction and cure rates are increasing for all of these cancers. Next slide, please. So then moving on to late effects. The title of this slide is Late Effects, No Organ System Spared. And I think that's one of the other reasons that a survivorship program is so important and individualized plans are so important. Because although no organ system is spared, the organ systems that are at risk for an individual are very individual. They depend on the age at diagnosis, they depend on male or female, they depend on the specific cancer, they depend on the treatment received. But the other point is, from head to toe, this cartoon or drawing shows that really no organ system is spared. So just to highlight some of the important ones, if you think of the head and neck area, the brain makes very important hormones, and some treatments impact the production of those hormones. The brain is important in learning. We have, childhood cancer survivors might have been diagnosed when they were 2 or 12 or 22. They've achieved very different levels of development, and the impact of the treatment can be affected by the age at which the treatment was delivered. And then vision and hearing, we work very hard to make sure anyone with visual impairment or hearing impairment has all the resources needed to optimize their quality of life and reduce the late effects. Heart and lungs are another big area. There are treatments that can be toxic to the heart. There are treatments that can be toxic to the lung. So things that are healthy for all of us: healthy diet, regular exercise, avoiding vaping, smoking, drugs, alcohol. Like, these things are so extra important in this population. So we try so hard to educate and help survivors be able to control the things that are in their control. Second, cancers can happen, and that is treatment related. And then again, because we're dealing with children and young adults, fertility is a very big issue, and there are some treatments that can impact fertility, and we want to make sure we give all the survivors the resources they need to optimize that as well. Next slide, please. Cartoons are so helpful. I think this one, I'm happy to say, in the future is going to need to be updated for very good reasons. So 2/3 of survivors will experience at least one late side effect. 1/3 of survivors will experience a severe or life-threatening condition. So another example of why survivorship programs are important, because individuals have to understand what they're at risk for to be ready to have the medical care they need to respond to whatever the medical late effect may be. If you look at childhood cancer survivors that were treated between 1975 and 2000 and compare them to survivors treated between 2000 and 2024, not only is the cure rate higher for the second group, but the late effects are actually lower. So I believe in the future we'll be adapting this slide, because it won't be 2/3 of survivors, it will be less than that. And it won't be 1/3 of survivors for a severe or life-threatening effect, it'll be less than that. So another reason survivorship programs are so important, to keep communication, to understand the risk as things evolve over time. Next slide, please. So the survivorship phase we like to think of as really a wonderful graduation. The focus shifts from recurrence of the disease to monitoring for these late effects. And the reason they're called late is they can appear months or years or even decades after therapy. So that we have this window in time where patients are still our patient to teach them what they know for the rest of their life. And over time, the PCP assumes more of the role, and eventually the majority role, for the healthcare, with just an annual visit to the oncologist or consultation as needed, and eventually transition fully to the PCP. We definitely want to indicate that the survivorship program remains available for you and your PCP for questions or concerns. And we receive questions from PCPs and patients for patients that have been transitioned previously, and we're always happy to take them. Next slide, please. So we do a lot of care coordination. We are so blessed to have experts in a lot of key fields. So we have cardiology expertise, that cardiologist who specifically focuses on the heart after cancer treatment, endocrinologists who focus on hormone effects of treatment, neuropsychologists who focus on learning after treatment, fertility. So all of these experts that focus in survivorship care partner with us. And then I list the PCP again, because I can't emphasize enough how important it is for a childhood cancer survivor or any cancer survivor to have a primary care physician. The modern convenience of MedExpress and Urgicare definitely has a role, but I think having that annual visit, visit with your PCP, so that whoever your doctors are have the ability to interact with that person and communicate this important information. Next slide, please. I think so. Individual survivorship care is something else that we've emphasized. And I think these 4 words really kind of emphasize the things that we do. In the case of childhood cancer survivors, education is so important. If someone was 4 years old or even 14 years old when they were treated, the doctors and healthcare providers were speaking with their parents. And when they're 30 years old, they're going to be the ones in the doctor's office. That's the first line to communicate the information. So we are just passionate about educating the survivors. We want to teach, based on that education, we want to teach survivors how to advocate. What are my unique medical needs as a childhood cancer survivor? And then screening. Screening may be different for a childhood cancer survivor than it is for a person in the general population. So things like colonoscopy that typically begin at age 30 may begin, at age 45 may begin at age 30. Mammogram may begin at age 25. And then the education, the advocacy, and the screening all lead the person to be ready for transition. Transition is not a single visit, it's a process that we work through with patients so that they can reach a point where they feel comfortable with their PCP and their PCP has the knowledge to be comfortable in caring for them. Next slide. One more, but you can't show this picture enough. We are just super excited that survivorship is on the rise. Next slide, please. And then just before I turn it over to Heather, just a few statistics about our program. We were established in 2008. Noelle will remember these times when we had a little file drawer with our manila folders in alphabetical order, and our numbers were small enough to do that. But we now have over 1,000 pediatric cancer survivors followed in our population. And Noelle has been instrumental in developing a database that allows us to really track the key information and follow patients over time, that we can easily search. If there's something that we learn about AML that we need to communicate to patients, within 10 minutes, she can get me a list of those patients. So I cannot emphasize enough the importance of the work that she's done. And then just some statistics. Our average age is close to 23 years, pretty much half male and half female. And then leukemia, lymphoma are the most common diagnoses in childhood cancer. So about 55% of our patients have had either leukemia or lymphoma, and then 45% are made up of all the other cancers. So that's kind of a background of past, present, and future. And now I will turn it over to Heather to talk about what happens in the actual survivorship visit and what we do before you even arrive for your visit.
Thank you, Dr. Tersak. So Noelle, if you don't mind just going on to the next slide, that would be great. Perfect. So just a little bit about types of visits in our program. Typically, can everyone hear me okay? Just before I dive too deep?
Yeah.
Okay, perfect. So typically patients transition to our survivorship program when they're 5 years off therapy or 5 years from treatment completion. Certainly it is on a case-by-case situation, and we are happy to meet with someone before that time. It's a process that's continuing to evolve as we get more resources, and eventually we may be able to see patients a little bit sooner. Typically, survivorship visits are annual visits in our program, although some survivors may have recurring visits depending on their individual health needs. So we do work with each patient individually to determine the frequency for follow-up that would be the best for them. We do also offer one-time consultations for adult survivors of childhood cancer. So if they have not previously followed in or are not currently in a survivorship program, we're happy to do a one-time consult with them and review their treatment history. We can create a treatment summary for them and make sure they feel comfortable with their individual screening recommendations for monitoring for possible late effects from their treatment moving forward. And currently, I'm excited to share that we are actually offering consults for survivors that were previously followed in our program and had transitioned. They may have transitioned their care years ago before we had new survivorship resources available. So we are currently reconnecting with these survivors so that we can ensure they have the most up-to-date survivorship resources available to them to help in continuing their survivorship care moving forward. You can go to the next slide, please, Noelle. So to prepare for a survivorship visit, it starts with an extensive chart review. We review the survivor's previous diagnosis as well as treatment history, whether it included chemotherapy, surgery, radiation, just making sure we have a good review of all of their previous treatment exposures and any complications from treatment that they may have had. We do also try to review other notes from other providers if we're able to view them in our medical records. So notes from their PCP, ER, so we can really get a good snapshot prior to the visit with the survivor. We do also review if they've had any recent testing. So that could be labs, or if they've had any recent echoes, MRIs since their last survivorship visit. We do review if there's any testing that they would need this year for their annual visit, and we do try to coordinate testing that they would need with their survivorship visit on the same day if possible, just to make it a little bit more convenient for the patient and their family. And then the final step in our preparation is preparing their treatment summaries. So actually, if you can go on to the next slide, Noelle, I think it's a little bit easier to talk about the treatment summary when you guys can see kind of what it looks like. So as Dr. Tersak mentioned, our nurse coordinator, Donna, she puts together these treatment summaries for each patient. And I like to say it's really a snapshot of their treatment history. It's really a great tool that can help support them in their transition of their care to their PCP, as well as just, for their personal reference so they can familiarize themselves with their previous treatment history. So you can see it includes their diagnosis, the date of diagnosis. We include any chemotherapies that they received, as well as if they've received radiation and what the amounts of radiation were and where the radiation fields were. So it's helpful to share with their other providers as well. If you move on to the next slide, you can see the second part of the treatment summary actually includes their individual recommendations for screening, for monitoring for late effects from their treatment. So the screening recommendations actually come from the Children's Oncology Group's long-term follow-up guidelines. These are a set of evidence-based guidelines for monitoring for late effects from treatment exposures from childhood cancer survivors. So they are a great tool and they are a free tool, but just to reiterate, they are intended to be used with your healthcare providers. So for childhood cancer survivors, we recommend, reaching out to your survivorship team or your PCP if you want to kind of look through those together. So moving on to the next slide. So a typical survivorship visit, it starts with an age-appropriate health questionnaire. So everybody will answer a questionnaire upon their arrival to the clinic. As patients get closer to the age of transition, we do include questions to kind of gauge and assess their readiness for transition. So that way we can, see where they are in the process and try to help them in any way that we can to support them in the transition process. We also include a history and physical exam, review if there was any concerns since their last visit. But I would say a big focus in our visit is certainly providing them with education as a childhood cancer survivor. So we do spend a great deal of time, walking them through their treatment summary, making sure they understand, their past treatment, as well as any necessary testing that they may need throughout their lifetime to continue to monitor for possible late effects from their treatment. We do also provide them with health links, which are a really great patient education handout that can kind of talk about some of their risks for possible late effects, and as well as things that they can do to promote their health. So I'll show you an example of a health link a little bit later. And then, as Dr. Tersak mentioned, we do work very closely with the PCP as well as other specialists, and we will refer the survivors to any specialist as needed, if there's any concerns. So the last piece of the survivorship visit is we do typically have, some individual time with the survivor to see if they have any concerns that they wanted to talk about individually, as well as assess, how they're feeling with their treatment history and their recommendations, if they have any questions or concerns. So just giving them some individual time in their visit. And as Dr. Tersak mentioned, the transition to the PCP, it really is a process that takes place, over time. So we work with each patient individually, and we start that process even at the first survivorship visit. So that way, when the time comes, we hope that they feel fully ready and supported. So moving on to the next slide. So I have a brief case presentation. I think it'll kind of bring everything together as far as, what a survivorship visit looks like. So I'm just going to go ahead and read the case for everybody. So Julie is a 26-year-old female treated for Hodgkin's lymphoma when she was 14 years old. She presents for her annual visit and has no complaints. Her treatment history included chemotherapy. You can see that the chemotherapies are listed below, as well as radiation. It was to her neck and mediastinum, which is the chest area. So moving on to the next slide. Based on Julie's previous treatments she received, she would be at risk for possible late effects to the heart, lung, thyroid, skin, as well as she would be at risk for second cancers in the radiation field specifically. So if you don't mind moving on to the next slide, Noelle. In Julie's survivorship visit, we would review with her the following recommendations for her individual testing and screening, and make sure, if she had any questions, we'd go through that. So looking at Julie's past treatment and her risk for late effects, we would recommend the following screenings. So, and again, these would all be listed in her treatment summary, so it wouldn't be something that she would have to remember everything when she left from the visit that day. She'd always have a reference with her treatment summary that she could bring home with her. So the first being annual history and physical exam. So as I mentioned previously, our survivors, we do typically see annually. So we would do a history and physical exam. We do also recommend an annual well visit with the PCP, which they would do the history and physical exam as well. Her echocardiograms, due to her one of her chemos she received and her radiation, would be recommended every 2 years at minimum. So during survivorship, we would help in ordering her echocardiograms and coordinating the scheduling to try to coordinate it on the same day as her visit. And then eventually we would help her transition her echo screenings to be done through her PCP as she approaches the age of transitioning her care to her PCP. So, I think another screening recommendation to point out would be her mammograms and breast MRIs would be recommended to start at age 25 or 8 years after treatment, whichever comes later. So that would be due to her risk or due to her radiation exposure to the chest area. Likely her breast tissue would have been exposed to radiation, and she would be at a slight increased risk for breast cancer. So that's why we would recommend the earlier screening. So again, we would talk through all of these recommendations with Julie at the visit, see if she had any questions, and if she was due for any of the testing, we would make sure that we were coordinating that with her. So moving on to the next slide. The health links, we would provide Julie with health links based off of her individualized risk factors and possible late effects from her treatment. So that way that she had a good education or a good resource, to kind of consult if she wanted to learn a little bit more about those after her visit. So some health links that would be helpful, that could be helpful to Julie, would be the skin health link, as well as the breast cancer after childhood cancer health link, which I mentioned before. If you actually go on to the next slide, you can see that this is an example of a health link. So I had pulled, just for this presentation, the skin health link. Due to her radiation history, she would be at a slight increased risk for radiation for skin cancer in the radiation field. So we would just want to make sure she had the skin health link, so that way She had extra education on that. It would be important for her to know how to protect her skin and warning signs of any mold changes that may require follow up with her healthcare provider. So you can see it kind of talks about some of those things in the health link. And then finally, we would work with Julie to help her in transitioning, all of those screening recommendations and all of her survivorship care to her adult PCP. As Dr. Tersak mentioned previously, we do have this window of time in survivorship to educate survivors about their individual and complex medical needs. So it's definitely our goal to teach the patients to be able to advocate for themselves, to continue their lifelong survivorship care. And we do want to equip them with resources to help them in that process. One of those resources is their treatment summary, as well as a newer resource, Passport for Care, which Noelle will discuss a little bit later in this presentation. So it's definitely a process that occurs over time. And as I mentioned before, we start preparing for transition even at the first survivorship visit. And we work with each patient individually to help them fully transition their care eventually to their adult provider.
Okay, can you hear me okay?
Yes.
All right, thanks. So I'm just going to talk a little bit about the type of research that we do through survivorship. First, going to talk about the database that Dr. Tersak mentioned a little bit earlier. So we keep track of all of our survivors through a database that we've developed. It holds contact information and diagnosis information for over 1,100 survivors. And we use this for, a variety of reasons. We can use this database, like Dr. Tersak said, to generate lists for all of our AML patients or patients with osteosarcoma or, patients with anthracycline over 125, allow us to get in contact with those patients. Or it also just allows us to stay in contact with our survivors in general by adding them to our newsletter that we send out quarterly, and also just making sure that we always have their most up-to-date contact information. And side note, if you are one of our survivorship patients on the call today, please do send us your updated contact information if you believe that you're not receiving our newsletters or if you feel like your information has changed in the last year or two. We also have original research projects that we do. We are currently working on an original research project in partnership with a career-based mentorship program that's called Connecting Champions. And in this project, we're examining how the addition of a mentor within a survivorship program like ours can address unmet needs within this population. And we also did a previous completed and published research project, and this one evaluated the role for connecting the PCP, the patient, and the survivorship team in a virtual room after the PCP completed history and the physical for the patient. And ultimately, we saw that this improved the survivor's comfort with their PCP and the PCP's comfort with caring for a cancer survivor. And then I just want to touch a little bit on the participation of our COG trials. And COG, it stands for Children's Oncology Group. So we participate in a number of clinical trials, both for patients on treatment and off treatment. And so I focus on the late effect studies, which mostly compose of patients off treatment, and a lot of them are within our survivorship clinic. And so most of these studies are, looking at the possible late effects of treatment, whether it's chemotherapy, radiation, surgery, or just an overall cancer experience. And the ultimate goal of most of these research projects is to prevent these late effects from occurring in the future. We currently have 6 late effects studies that we're enrolling on. So if you go to the next slide, Noel, I can just review 4 of them that we have going on right now. We do have a physical activity intervention that examines ways for to encourage young survivors to be more active. We have another one that identifies potential risks for potential risk factors associated with key adverse events. And examples of key adverse events would be like a stroke, a second cancer, heart disease, etc. We have another one that examines the late effects of survivors with ALL or AML with Down syndrome by looking at clinical outcomes, neuropsych differences, and their quality of life. And we have another study that examines how blood patterns may be related to heart health in Hodgkin's survivors. And that concludes a little bit about our research.
Okay. So my name's Noelle Conover, and I coordinate the Survivor Connect program. Can you hear me? Yeah? Okay. So basically, Survivor Connect is a unique program that we've developed over 12 years ago to provide what we call wraparound services for the patients in our program. And I like to start with this diagram because really we view our relationship with the survivor as part of a team. We are a team, we are a triangle, we are closing the gap. We have the survivor at the top, we have the PCP at one end, and we have our survivorship team at the other. And the goal is really to provide as much communication in this gap as we can, and to provide as much support and services to our survivors as we possibly can. So basically, what is Survivor Connect? Well, first of all, it has a TM after it, you may notice, and that means it's trademarked. We were able to get this program trademarked because it is one of the most, certainly the name is unique, but the program is very unique. And what we found is in most survivorship programs across the country that we're aware of, no program is giving this level of service to their patients. Many will see the patient once a year and they'll do the health, the different health assessments that we do. But in terms of the other services, we really haven't found a program quite like ours. It started with a grant. You may have heard of Hope on Wheels, the Hyundai project. Hyundai is the largest company in the United States that gives to pediatric cancer and pediatric research. They gave us a grant over 12 years ago to develop this program. And that actually is what paid my salary for many years. My salary was grant funded, and that enabled us to bring somebody on board back when it was just Dr. Tersak and a nurse practitioner. And we thought about, well, what are the kinds of services that we could offer that would really be unique? And the first thing we came up with was a website. And back then, you know, this is before social media even existed. So having a website was really important. And we still have that website. It's a CHP, a Children's Hospital website. You can always get there by just going to chp.edu/survivorship. And that tends to be a more static place for information, you know, but it's there. And that enables, let's say, a survivor who comes back to the hospital and they think, gee, I'd love to be a part of a program. Where could I get started? And they can go to the website and find us. Another thing that it enabled us to do was to develop a brochure. And the brochure lists everything about our project, and it's given at each new visit to our new patients so that they have something they can take with them that tells them where they can get information. We also have a newsletter, as Marlena mentioned. It's a quarterly newsletter. We love to feature survivors in our newsletter. So a survivor story is what it's arranged around. We always ask a survivor to share their story. We believe that's really important because our survivor population, many of them went through treatment when they were young or when they were teenagers, and they felt so alone. And what we found is that the newsletter, in listening to each other's stories, it brings them closer together. And we've actually had some survivors that became friends through our newsletter, reading each other's stories and reaching out. And that kind of story really warms our hearts. As well, in the newsletter, as well as providing a survivor story, we'll publish all kinds of things. And we've done many programs with Lending Hearts and other cancer organizations, and we publicize any kind of events that are coming up. They go in our newsletter, as well as any information that might be just relevant to our survivors, things about research or new things that have been discovered. We also do email blasts. If there's something important, we'll blast out the information. And then, of course, social media came on board, and that was in our 12 years. We in the middle of that time, we decided social media might be a way to communicate with our survivors. And what we're finding is that, especially since our average age is 20 years old, most of them are on social media. And we're finding that we had to figure out how to do Instagram and how to do Snapchat and we're even looking at TikTok, because the idea is that we really want to communicate with our survivors in the best way possible. And so social media really is that way. What else do we provide? We do events. Probably our biggest event that we've been known for over the last 12 years is our National Cancer Survivorship Day. That's always the first weekend of June. It's always the first Sunday of June. And in the last few years, that's coincided with the walk at Children's. It's always that Saturday. So it's a big, big day for our survivors. And we've done it at Kennywood. Unfortunately, during COVID, we had to shut that down. And this year, June 2nd, 2024 is going to be a return to Kennywood for us as a group. And sometimes we've had more than 500 survivors and their families come to Kennywood to celebrate National Cancer Day. And I'll tell you what, it is our favorite day of the year. There's nothing like seeing Dr. Tersak hugging these patients who, 5 years prior to that, they were fighting for their life, and now we're celebrating survivorship. We also do educational symposia. We invite speakers. We've had all kinds of events that, like this, are spreading information to our population. We've done them online. We've done them in person. We're pretty much wherever survivors want to go, we'll go. We also have baseball and hockey games that celebrate our survivors by giving them free tickets. And this year we tried something different with Kennywood Lights, which was a way to bring our survivors together at the holidays. And Kennywood gave us some tickets for our survivors, or we were able to purchase them, and we had a really good time. We also do community awareness events. We do fundraising. We meet with donors. We're very lucky to have some very, very supportive donors. And everything that Survivor Connect is, with the exception of Dr. Tersak and Heather with their medical treatment, everything in our program is 100% donor supported. So, that really brings it home that these kinds of services, they're not provided through insurance. It's really hard to pay for these services, but we have donors that have supported them. Now, one of the speakers alluded to Passport for Care. Passport for Care is another tool that we provide for our survivors, and it came out of Texas Children's Hospital, and the Cancer Oncology Group formed a website that is called Passport for Care, and it's basically a portal or repository of where information can be stored. And what we found was that survivors do not like their information in paper. Many times we find the treatment summaries outside in the trash can on the way out, that nobody wants to collect paper at home. So Passport for Care is a vehicle where we can upload all of their information to one place, and then they're able to access that information. It is completely HIPAA compliant, it's secure, it's a place where everything about them can be stored, and they can choose to share that information with their PCP or with any doctor that they go to by simply printing out a report or even just taking their telephone and with them, and it's on the phone. And we find that a lot of our families really like this tool because it replaces the wagon of information that they used to pull behind them on all their visits. We know our families collect a lot of information about treatment. So Passport for Care is really important. It's free of charge. We are trying to get all 1,100 plus of our survivors verified and in there, and so that we know that that's a great repository of information. And so basically that is what Survivor Connect is, and that's basically the end of our presentation. We've left a few minutes for questions, and I don't know, Vaso, if you know if there's any questions, or we're happy to answer anything.
I do not have any on me at this time, but I certainly welcome anybody to drop in the chat box or unmute themselves and ask however you feel comfortable. Please go ahead. May I throw out a question? I wanted to ask about thyroid being one of the areas for post-treatment screening. What sorts of things, just generally speaking, do you generally see when it comes to the thyroid?
Yeah, so great question. For the case presentation, the reason the thyroid screening was on there is the patient received radiation to the chest and neck, so likely there was some exposure to the thyroid. So typically we will monitor thyroid function labs annually. Just sometimes we can see hypothyroidism following that radiation exposure. Sometimes you can also see thyroid nodules as well. We initially start with the thyroid function labs and, certainly a physical exam and kind of go from there.
Thank you. Anybody else?
This is Deborah. My question is, typically, how long do patients spend with you in the survivorship program before being able to transition to adult care?
Yeah, another great question. I think, again, it's a little bit individual. I think it depends a little bit about the risk of late effects. Not all pediatric cancers have the same risk of long-term effects. Depends a little bit upon area where family lives, medical resources available. We often follow through mid-20s just until patients are either graduated from college or established in employment if they're not seeking additional education, established with a PCP that we can communicate with. So I would say most patients by the age of 25, 26, but that's not 100%. And we have some patients that transition earlier because their risk is low and all of the things are in place for transition.
Thank you.
Sure.
Well, if we don't have any other questions, I would just really like to thank all of our speakers and all of our guests for being here. I think this is a topic of conversation, as Dr. Tersak had shared, the past, present, and the future, that so much will continue to evolve, and so grateful for the research and the information that's being compiled for the better health of our children and young adults as they forge ahead, and what that means. We probably can't stress enough the importance of those annual visits, whether to survivorship and PCP, just always staying on top of our health, how very important for all of our lives. But I really thank you all for being a part of such a tremendous and ongoing conversation.
Thank you, Vaso. Thank you for having us.
Thank you.
We were very happy to be able to present tonight and look forward to partnering with you and your team in the future.
Thank you, Dr. Tersak. That means a lot. Well, we will be catching up with one another again, and thank you all. Have a wonderful evening.
Bye-bye.
Thank you.
Thank
Bye.
you so much.